morning, students. Here, Neela ma'am from SKM Public School. You already know my name also. So today, students, you are going to learn about social science civics chapter number 3. That is how the state government works. Already you have read this chapter, how the state government works. Chapter number 3, civics. Today I have taken some of the questions from your NCERT textbook, that is page number 31, and there are some sectional recapitulation questions based on the chapter. So here, when you have read the chapter, you have read about Patalpuram. You have read about Patalpuram. So what happened? What is happening in Patalpuram? When you have read this chapter and you found what was the problem over there. So in Patalpuram, the district hospital is full of patients with acute diarrhea and 10 of them have died. So what was happening in Patalpuram? In Patalpuram, the district hospital was full of patients with acute diarrhea and 10 of them have died. So this diarrhea is one of the disease which spread through contaminated water. Through contaminated, unclean water. Due to lack of, we can say, safe water. So what will you write here? So what is happening in Patalpuram? In Patalpuram, the district hospital is full of patients and with acute diarrhea and 10 of them have died. Then why is this problem serious? This diarrhea problem, why was this problem serious? So this problem is serious because there is shortage of water and the people receive water supply once in 3 days. As a result, people are drinking unclean water. So ये जो this problem कि people were dying and the hospital was full of the patients with acute diarrhea, and this happened due to shortage of water, and the people were being supplied water only for 3 days. Only for 3 days. As a result, people are drinking unclean water. If they are not getting water, they were taking unclean water. Okay, and they were taking unclean water. Then third question. Question number 3 at page number 31, Civics NCERT book. What action do you think can be taken in the above situation, and who do you think should take this action? Discuss. So, in the above situation, various actions can be taken. There must be regular and clean drinking water supply in the district. The sanitation, cleanliness issue of the district must be taken seriously. There should be cleanliness. The action should be taken by the district collector, medical officer of the district, and Zilla Parishad's committee on sanitation. When proper sanitation and proper safe water supply will be there, only then there will not be here acute diarrhea disease problem in that area. So in the above situations, there must be regular and clean drinking water supply in the district. The sanitation issue of the district must be taken seriously, and the action should be taken by the district collector, medical officer of the district, and Jila Parishad committee on sanitation. And students, in live class, you have read this chapter also, and I have made some of the students MLAs, and all were speaking about that. And some of the questions are there. What were the main arguments put forward by different MLAs who thought that the government was not taking the situation in a serious manner? So, what was the argument of the different MLAs? The main arguments put forward by MLAs were, what were the arguments? When different MLAs were there, the government is not able to prevent the problem like diarrhea that has caused 15 deaths in Akhandgaon. In Akhandgaon, there is bad condition in government hospitals, but government is not appointing sufficient number of doctors and other medical staffs there. Third argument was that there is serious shortage of water air in Tolpatti constituency. Women have to travel up to 3 to 4 kilometers to fetch water, to take water. Here, the women have to travel 4 to 5 kilometers to fetch water. The government is not providing tankers required to supply water. Ponds and wells have not been cleaned and disinfected. This is question at page number 36. Page number 36. Page number 36, which I have discussed now. So, if you were the health minister, how would you respond to here the above discussion? अगर आप हेल्थ मिनिस्टर होते तो इस कंडीशन के लिए आप क्या करते? If I were the health minister, then I would have responded to the above discussion in many ways. First is कि you would have called upon all the district magistrates, chief medical officers and chairmen of the Zila Parishad in the state too. Then what will you do then? You would give 10 days to these officials of affected district to control the situation. Otherwise, they would be suspended for how much duration? 6 months. The officials of other districts would also be warned to take care of their district properly. Students, I am talking about question number 2 at page number where it is 36. Okay, NCERT book, Civics chapter number 3. Then the officials of other districts would also be warned to take care of their district properly, and you would allocate emergency funds, and allocate means distribute funds and other required materials to control the situation instantly. At the starting position, you will provide funds so that this particular situation over there that can be controlled instantly. Yes. Do you think the above debate would have been useful in some ways? How? And discuss this. There was debate of many of the MLAs. and there was also one of the MLA from opposition party also. So what will you say? Do you think the above debate would have been useful in some ways? Yes, the debate would have been useful in various ways because of the debate. The Minister of Health and Chief Minister visited the पातलपुरम district. इस जब ये डिबेट हुआ तो क्या हुआ, उसका क्या असर पड़ा कि जो क्या था, मिनिस्टर फॉर हेल्थ एंड चीफ मिनिस्टर, they visited that पातलपुरम district. They also met the families who had lost their dear ones and also met the people in the hospitals also. They announced some compensation. Compensation means muawza for these families whose members were dead. Then I think 10 of them have died. The situation of Patalpuram, means 10 of patients were dead due to acute diarrhea. Then they announced some compensation for these families. They also requested the Minister for Public Works for proper water supply also, so that clean water can be provided in that particular affected area. Okay, so try to learn more. Question number 4 is, in the working of the government, explain the difference between being an MLA and an MLA who is also a minister. एक MLA जो एक minister भी है. So an MLA and an MLA who is also a minister have the different roles to play in the working of the government. An MLA has the duty to raise the problems of the people of different localities and groups, both in legislative assembly and outside it, in media like newspapers, TV channels, etc. Thus, an MLA can draw the attention of government towards a particular problem, and an MLA as a minister, what is his work? So, a minister has an active role in the working of the government. Government of a state consists of various departments and ministers headed by ministers. Each minister forms a policy for working of his ministry on the basis of agenda, manifestos of the party and the promises made by the minister to the people, his constituency during election. कि इलेक्शन के ड्यूरिंग, जब वो जीतने से पहले तो प्रॉमिस करता है अपनी कॉन्स्टिट्यूएंसी में कि मैं ये वर्क करूंगा, मैं ये वर्क करूंगा, एंड ही ट्राई टू fulfill his promises also before becoming an MLA. So MLA बनने से पहले वो अपनी कॉन्स्टिट्यूएंसी में क्या करता है कि कुछ प्रॉमिस करता है कि if I will win and I will do this and that, and particularly that work is done by him. So students, try to read this chapter carefully and learn more and more. So till then, stay alert, stay healthy, mask yourself, take proper care. Thank you. Have a nice day. Thank you. God bless all of us.